Welcome to the anatomy of the foot and the ankle. What we're looking to do, our aim is to gain a more in-depth understanding of the foot and the ankle. And what we're going to do in these first two lessons is look at the ankle, and then in the second two lessons we're going to be looking at the foot. So with regards to these first two lessons, we want to understand the bones, the ligaments, the tendons, the muscles and the movements of the ankle. What we're also going to do with regards to the movements is not only look at it in the traditional sense with the foot moving at the ankle, but we're also going to look at it from the perspective of a stance foot, so with the foot on the floor and the different movements and what that looks like. To start, we've got the ankle joint itself, so it's a hinge joint which consists of the lower parts of the tibia and fibula, which are the two bones of the lower leg, and then the upper portions of the talus, which is the bone that sits inside here. The lateral and medial malleoli, which are basically the two big lumps on the inside and the outside of the ankle, deepen the socket into which the body of the talus fits snugly. The shape of the bones, the strength of the ligaments and surrounding tendons make the joint strong and stable. And what we're going to do over the next few minutes is talk a little bit more about those bones, ligaments, tendons and muscles. Now we're looking at the ligaments of the ankle, and I'm picking out a few of the more well-known ones, some of the more prominent ones that come out in injuries and things like that. So first of all, we've got the medial or deltoid ligament, which you may be able to see is this ligament just here. It's strong and is attached by the upper apex to the tip of the medial malleolus. So it's a big, strong ligament, one of the bigger ligaments within the ankle. The lateral ligaments are weaker than the medial ligaments. So this is the medial side here, and this is the lateral side or inside of the ankle and outside of the ankle here. So these ones on the outside are slightly weaker than the ones on the inside, and the ones that we're talking about on the outside are the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. And we've got those. You've got the anterior one in here, the lateral one here, and the posterior one in here. Now these are the ones that are going to be affected in a twisted ankle or an ankle sprain. Again, as I mentioned, they're generally weaker, simply down to the bony structures here help with the strength, but as you can see, they're much sort of thicker ligaments as well, but you've also got bony structures which don't allow the ankle joint to move in certain directions, which would aggravate these quite as much. This is a lot more, with regards to the bony structures, a lot more unstable, if you will, and it will tend to bend that way. So those are the main ligaments of the ankle. Obviously, when we look at the foot, we're going to delve a little bit deeper into the ligaments of the foot and how they influence and interact with the ligaments of the ankle as well. But so far, all we need to understand is we've got the medial or deltoid ligament, which is the stronger one. We've then got the three lateral ligaments, which is the anterior talofibular ligament, calcaneofibular ligament, and posterior talofibular ligament. So we've got those, we understand those. Also, the ones on the outside are slightly weaker than the ones on the inside. So what we will now do is move along onto lesson number 2. During lesson 2, we're looking at the tendon of the ankle and also the muscles of the lower leg and ankle. Now, obviously, we're talking about the tendon, which is the Achilles tendon, and what it's doing is it's joining gastrocnemius, the soleus, and the calcaneal tuberosity. So we've got the heel bone down here, we've got the soleus underneath the gastroc, and then we've got it joining into the femur up here, which is just above the knee. What we've also got is the hamstrings coming down, crossing over with the gastroc and the soleus, the gastroc, and joining in below the knee. So we've got that mechanical stability and strength to the knee from the crossing over of those two muscles. We've also got something similar with regards to a built-in mechanical strength and stability into the way the Achilles works as it crosses from the lower leg to the foot. So as the tendon fibres of the gastrocnemius descend, so we've got the sort of the gastrocnemius muscle, which will then converge into a tendon. As it descends, they converge, so the Achilles tendon narrows. So we know that, and it just looks as it comes in there and then joins into the heel bone at the bottom. However, there is no muscle and tendon sort of border as described. They converge into each other, mash and mesh into each other, and just create an area where the muscle converges into the tendon. It narrows and then goes down into the Achilles tendon, and that in itself, although throughout all muscles of the body, that in some respects is giving a degree of mechanical strength to it as well. What's also happening, the fibres also rotate around the soleus. So what is happening when the gastroc and the gastrocnemius and the soleus in some respects meet, this type of metaphor is happening. So you can see here you've got these sort of wrap around parts, and that is giving a degree of strength to the area. So it's in some respects creating one muscle from two, or one unit from three different tissues, i.e. the gastroc muscle, the soleus muscle, into the Achilles tendon. But what this is also doing, this spiraling effect of the tendon fascicles, result in less fibre buckling when the tendon is lax. So what that basically means, if you squash this rope together, it's then able to maintain a degree of its structure and its function through that, and less deformation when the tendon is tensioned. So again, when you're pulling it apart, it can cope with the load sufficiently. So we've got that effect throughout the Achilles tendon. So as we start to build and understand the anatomy a little bit more, when it comes on to the function, we can start to understand the function because the structure around that function is able to cope with it. What we've then got is the retrocalcaneal bursa, which is this one just here. It's horseshoe shaped, 4 mm in width, 8 mm in depth, and the bursa is important in maintaining constant distance between the access of the ankle joint and the Achilles. So what it's helping to do is maintain the distance between here and the Achilles tendon, and also give greater angle and give a greater fulcrum to the area, so the Achilles tendon can work more effectively. And again, with a greater lever, it can cope with more load going through that area of the body. So that is a basic overview of the Achilles tendon. What we'll now do is look at the muscles. And there are many muscles of the lower leg. As you can see here, I've written out 13 of them. So in the lateral posterior, so the outside and back, and then the anterior as well. So I'm not going to go through each one individually and talk about their individual functions, but what they will be doing, they will be helping to stabilize the ankle joint. They will be helping with movement of the toes, and they will also be used, or they are used most effectively as a spring. So we're talking more now about gastrocnemius and soleus, which are used much more effectively as a spring to propel us forward in walking and mainly running. So what that basically means is, if we've got the toes there, the foot there, and then we go up. So let's just say the toes hit the floor here. What will happen is the heel will come closer to the floor. That will then lengthen through the Achilles tendon, gastroc, and soleus, and then that is essentially like priming an elastic band. So it drops down towards the floor and then springs back up. and that in some respects is the best use of the gastroc and the soleus. But we've got all these other muscles that come with it. So you've got sort of these ones here controlling toe movements, so on and so forth. Posterior or tibialis posterior, or posterior tibialis, whichever way you want to say it. This one goes up behind the shin bone. So this one's in front of the shin bone because obviously tibialis, tibia, anterior front, tibialis, tibia, posterior behind. So all these different muscles will play their part. This one gets neglected for sort of massage and release, but it can be quite tender. So you know, there's lots that can be said about these muscles, but it's very much just understanding them as a group, in that they control the movements of the toes, they control the movements of the ankles, or of the ankle, and they also give strength and elasticity to the Achilles tendon and assist it to work, and in some respects help propel you forward as you walk and run. For the movements at the ankle, there are essentially two, but we're going to talk about four. So the two of the ankle is dorsiflexion and plantar flexion. Now what that basically means is if my foot is off the floor, so this is my shin bone, and I've got my toes pointed up, and we've got a small angle here, that is known as dorsiflexion. If I have my toes pointing down to the ground and a much larger angle here, that is known as plantar flexion. Now if we look at that from a little bit more of a functional perspective, if I've got my foot flat on the floor and I've got my shin bone at an angle here, that is known as dorsiflexion. And again, if I've got my foot on the floor and I'm back like that, that would be known as plantar flexion. So when it comes to exercise and movement, there's a lot of talk about dorsiflexion in certain exercises, in certain movements. And to some degree, we do need adequate amounts of dorsiflexion. With regards to plantar flexion, as a general rule, it's not as important within function, or in certain functions, I should say, as dorsiflexion when it comes to squatting or lunging and things like that. But it is a necessary part. So if we are testing for both of these, we want to have adequate amounts of both. But generally in the population that we see, people have reduced dorsiflexion, and then that affects function. The other ones that we're talking about is inversion and eversion. Now these take place at the tarsal joints, which are in the foot, but I just thought I'd pull them all together because we're talking about function a little bit more. It makes sense to sort of talk about them together. Now again, if this is my shin bone, I'm looking at the back of my leg, I've got my foot and it's level like that. That would be the sort of neutral position. If I've got my leg and my foot is pointing inwards, that would be known as inversion. If my sole of my foot is pointing outwards, that would be known as eversion. Now again, if we take that into a slightly more functional perspective, and we have the foot flat on the floor, when the ankle goes, or when the knee goes outwards, out here, so we have one foot on the floor and then the shin bones go up in this direction, that would be known as eversion. And when the shins go inward, like so, that would be known as inversion. And again, when it comes to function, certainly in squatting, we want good ability to evert the ankle. So that is having the structures on the inside of the ankle. So we've talked about these, the deltoid ligament mainly, are the big thicker ligaments on the inside. We want them to be able to lengthen, to be able to give us this eversion. With regards to inversion, this is now talking about the slightly weaker muscles of the outside. They need to lengthen, and as a general rule, because they are weaker, because people may have had certain injuries to the outside of the ankle, they will be seen to be more lax, so they are able to move in the direction that we, in some respects, want them to move, but we don't want it to be excessive, obviously. So what we need to be focusing on is improving dorsiflexion and eversion.